Good morning, Research Medical Center. It's Julie Filbeck, your Chief Nursing Officer, here again with your Stroll with your Nursing O. Today, as we kick off our first segment of 2024, we actually bring a very special guest. Today, I'd like to introduce, as my Stroll guest, Dr. Paul Hancock. Dr. Hancock, you want to introduce yourself to the team?
Yeah, good morning, Julie. Paul Hancock, Chief Executive Officer at Research Medical Center. I've been here since April of 2023, so enjoying my first year at Research and just have fallen in love with this fantastic hospital. And really, the hospital is not the building, the hospital is the great people who make up Research Medical Center.
Absolutely. All right, you ready to start strolling?
Let's roll.
Let's do it. Okay, so here's your first easy question for your coffee in the morning. Do you prefer hot or iced?
Oh, definitely hot.
Man after my own heart
And
there.
espresso.
Okay, well that's even better.
Yeah.
I like that. All right, so tell me at home, your pets, cats or dogs?
2 dogs, always had dogs. We're not cat people. Right now we've got Max and Milo. They're a 7-year-old sheepadoodle, sheepdog poodle mix.
Yeah.
Brothers, litter mates.
Mine are litter mates as well too. Brothers, they're boxers. Okay, vacation spot, beach or mountains? Where do y'all like to go?
We mix it up a little bit, but I'm a mountain guy. I love the mountains.
Yeah, my husband chooses the mountains, I choose the beach.
Yep.
All right, so on a Saturday, rainy day, you got nothing to do. I was gonna say, what are you gonna binge on? But maybe it's not TV. What are you gonna binge on?
I read a lot, so I'm definitely not binging on TV. If you ask me if I've seen that TV show, unless it was an actual football game or baseball game or basketball game, the answer is no.
Live sports always a good thing for me.
Yeah.
Okay, so tell me this, what was your inspiration for becoming a provider?
For me, it's really about purpose, and it's really tied a lot to my personal faith.
Yeah.
And the idea that, I was created to do things and accomplish good, use my talents to serve.
Yeah.
And that's why I'm in healthcare. That's why I became a physician.
I love it. Okay, what advice would you give your younger self? Go back in time.
Ooh, that's a really tough question. Don't break the running habit.
Don't break the running habit. Okay. All right. There you go. We got to keep up our own self-care as well, too. Okay. How about this? What's your hidden talent that maybe you have that not everybody knows about?
Oh, wow. Hidden talent.
Yeah.
I don't have any hidden talents that I can think of. Let me think about that.
I don't have any either, but my children all have that ability, and my husband, to roll their tongue.
Oh, I can roll my tongue.
Oh, they love to, they love to tell me that they all can, but I can't.
Yeah. When I was in high school, I was famous for slurping Jell-O.
Oh.
Yeah, it's an amazing thing.
That's fantastic.
You take a square of Jell-O and you just breathe it in through your mouth, not your nose. But it's amazing.
I feel like during hospital week, maybe there's a challenge somewhere in there with Jell-O.
I'm not going to do that anymore because now I know the consequences of aspiration, and I'm not going there.
Oh, I love it. All right, so here we are kicking off.
Jell-O pneumonia would be a new thing.
I don't, we have an ICU bed for it if you need it. I know some good people that can take care of you.
Right.
2024, we're kicking off. When you think about the future of Research Medical Center, what are a couple words you would use to describe where we're headed?
We're headed into an incredibly bright future, strong, continuing to deliver on our mission, and yet delivering on our mission to provide care to patients at an even higher level.
Yep.
We are continuing to ramp things up, and the future of this hospital is just amazingly bright, and I'm so encouraged and optimistic about where we're headed.
I believe that as well too. All right, so here we are. We're coming to a close at the coffee shop. Same question I ask all of my guests. What do you wish others knew about Research Medical Center?
I wish people throughout the community really fully appreciated all the incredible work that we do here. We've got such great staff. We have teams of people performing at the very highest level every day.
Yeah.
And I just don't think that's fully appreciated throughout the community. I think there are pockets within the community that get that, but the community as a whole does not understand it.
I feel like that's a part of my purpose and mission driven every day is to make others be aware of what's happening in this building.
That's right. You
survived.
I did it.
So thank you so much. I appreciate you being a guest with us. Let's go in here and I'll treat you to some coffee this morning.
Good deal.
All right, so we have our favorite team members as always in here. LaFayette always takes care of me, by the way. She's amazing. All right. Thank you, ma'am. I appreciate it. So here is your hot coffee for you.
Very good.
All right. And so here we are for our first segment of Stroll with your Nursing O for 2024. Thank you so much for joining me today.
It's been a pleasure, Julie.
Thank you.
Happy New Year.
Same to you all.